And now we are going to follow the theme that we were talking just a few seconds ago, because in the next session, what we are going to do is to look at the opportunities that personalized medicine has to offer to improve healthcare systems. That's going to be in this session that is supported by Amgen. And this discussion is going to be moderated by Fina Llados, the General Manager of Amgen Spain, and will benefit from the experience of knowledge of Josep Maria Borràs, Director of the Catalan Cancer Strategy, Enrique de Álava, Professor and Chairman of Pathology at the Institute of Biomedicine of Sevilla and Virgen del Rocío University Hospital, Cristóbal Belda, Director of the Institute of Health Carlos III, y además Juan Cruz Cigudosa, Government of Navarre Minister for Universities, Innovation and Digital Transformation. So now here we have Fina Llados, who is going to moderate this discussion, and it's everything ready for you. Thank you. Hi.
So good afternoon, everyone. I'm Fina Llados, General Manager for Amgen in Spain and Portugal. I would like to welcome everybody, whether you are present here, and I see some people here, but also online. And it's, I think, a great opportunity to join to a round table today that despite we have a lot of chairs here, we have many of their speakers outside of the room today. And as I was already saying, this session, it's a great opportunity to talk about one of the hottest topics that we have today, which is around personalized medicine, also known as the precision medicine. Adapting the treatment to the genetics and also to the patients and the oncologic patients is a key thing for us to do already today, but also in the future. It was something that was seeming impossible some years ago, where we had some patients that we were starting treatments without really really knowing what was the genetic profile. And we have already advanced a lot on that, and we already seeing today patients that we very well understand the mutations. But we are not at the moment where we already do that routinely, and also we should think about how we should proceed in the future. We know already that cancer is the second reason of death in our world, and it's enough reason to say that we need to work harder on that. And the possibilities of the precision medicine are immense, and we already have seen in many institutions that they are already doing a lot of work, and we have scientists today and also really voices that are relevant for us. And despite we already have gone through many steps on that and on the right direction, I think it's an opportunity that today we really have a thought and also have a voice of the people that are referenced to talk about what they think we should be doing to really improve in our health system and how we can apply that in the research, but also in their treating our patients. So with that, I would start introducing the speakers, and I already see on the screen Dr. Cristóbal Belda, that is a director of the Institution of the Salud Carlos III in Madrid, under whose umbrella the National Plan of Personalized Medicine is being already defined. And in addition to being a doctor and a surgeon, he's a specialist in medical oncology. All also with their more than 15 years experience in the study of biomarkers and the management of research and development. And it's really a voice, a super voice to talk about that. I had also the chance to talk to him also last week, and he is, I think, passionate about this topic. And I think he can provide also a vision on the plan and also priority that we currently have as the government priority today. We have also a second speaker that is Josep Maria Borràs. He is very well known as being the scientific coordinator of their National Health System Cancer Strategy. And he's also the director of the oncology plan in Catalonia, and therefore also the regional level has their experience already to start executing the precision medicine program for the patients in this region, and also having a program for and having a clear strategic vision at the national level, but also experience at the regional level. Last but not least, it's also critical to have a very close view on the patients in that sense. We have also a third speaker, which is Dr. Enrique Álava Casado. He is the director, he is from Navarra, despite he is also working in Virgen del Rocío de Sevilla, and he is the head of a pathological anatomy clinical management unit in that hospital, and he also collaborates with the Andalusian health system, and he has also worked in their next generation sequencing and having also some data on their cost effectiveness analysis in this topic. Also, and last but not least, and we are waiting here for the consejero of Navarra, is Juan Cruz Iguedosa, the Minister of University. I was hoping having him here with me, but apparently I'm alone today. But he's coming also with us in that session. And he's the Minister of University, Innovation and Digital Transformation of the government in Navarra since 2019. And in addition, he is also a degree in biology with a specialization in human genetics and biotechnology, and his experience is also leading the development of the comprehensive strategy in their personalized medicine also in the region. And he also has, of course, an interesting perspective on how integrate genomic and the regional system. So with that, I would perhaps start also asking some questions here. And I would, just for the audience to know, we'll have 20 minutes talking about their, and just asking some questions to the speakers. And we will have also a chance to have questions from the audience here, only for the ones that are present here, but not remotely, but only all the people that are here could ask also. And first of all, I would like to know from your point of view, the ones that you are remotely connected, what are the three most important challenges that must overcome their system and the national health system and the cancers in Spain on the patients to take advantage of the growing opportunities? I would stop here just to welcome Juan Cruz, that it's, at least I'm not alone anymore, so it feels can feel good.
Yeah.
Thank you for being here.
Thank you.
I already introduced the speakers, and just thank you for hosting us today.
Okay.
And I'm just kind of just throwing a first question to their speakers, and I would start asking the three most important challenges that we have in the national health system to really getting implementation of precision medicine to the cancer patients in Spain. And I would like to start asking Dr. Cristóbal Belder about his view on that. So, Cristóbal, and Director, could you go through the answer of the first question?
Okay, thank you. Thank you very much. It's my pleasure to be with you online, but it's my pleasure. First of all, I think that the first barrier we have to implement the personalized medicine, the precision medicine into our health system is the way we analyze the real impact precision medicine will have on our real patients. Keep in mind that probably we all agree with the concept of improving the precision of the medicine we do in clinical practice, diagnosis, treatment, rehabilitation, prevention, and prediction. I'm sure of that. However, when we include a new technology, a new way of doing medicine into clinical practice, we perform clinical trials. What's the way we are going to use to check what's the impact of the precision medicine into clinical practice? That there is a lot of science we have to do before crossing this first barrier. Second, the mind of the clinician and the way we interact with patients. There's a new way for clinician to do medicine. It's a new way for clinician to interact with patients. This is, I think, in my perspective, second and third. That probably it seems that more difficult to cross the technology and the infrastructure adoption of all our hospitals and primary care settings to implement this new way of doing medicine. This is, in my perspective, the first three limitations we have to overcome, to incorporate this concept, the new concept of medicine.
Thank you. Now I turn to Juan Cruz. The main three challenges that you foresee to implement the precision medicine in our health system. So what's your view on that?
It's a tough question. It's not an easy answer. I think from my experience also as a researcher in the personalized medicine ecosystem, I think there is still a clear gap between what we know on, if you allow me, the scientific discovery of biomarkers and the preclinical utility of those biomarkers and the common and frequent implementation in the system. I think that we have accumulated enough data to be everybody convinced about the utility of biomarkers in personalized medicine, and that goes even beyond research, that goes to clearly benefit the patient. So there is proof enough in the literature about that. However, we face some challenges to be implemented in the real world. One of them is that although we have a tendency to think that technology is really available for everybody, the truth is not that clear. I think we should have still a lot of room for improvement in terms of having technologies available for clinicians. And second step, I think training on those health professionals have to be rethink, have to be broadened, have to be really convinced that medicine is no longer a medical-patient relationship, has to have room for bioinformaticians, for genomics people, for epidemiologist people, taking into account for all the system, and that's one of the things. So training in terms of providing training in new technologies as well as in interdisciplinarity. And then the third part is that we don't know exactly, I don't think that we have listened enough to the patient. So I think we should take more into consideration. Patient empowerment is something that we should be taking into consideration for the next future. So the three challenges: technology is not there, training is not yet there, and patients are not invited to the party.
Thank you very much. So 3 challenges already pointed out also by Juan Cruz. I see here also Dr. Borràs. I would like to get also your view on the 3 challenges that our health system may have in getting their precision medicine in place. What's your view there? What are the 3 challenges?
Well, I think that's it. Can you hear me well?
Yeah, sure. Thank you.
Okay, thanks. No, because I have had some problems of connection. I agree that this is a technology, a growing area of research and a growing area of technology development. And also the dialogue with patients has not been really established in our country. So I think it's important to think from the health services perspective that really there are tests and biomarkers that should be applied in clinical practice. So we have to provide, and this is what we try to do here, we have to provide these technologies in reference centers for clinical purposes and trying to also make these results available, this data available for future research, because I think this is something that we should consider from a continuum between research and healthcare.
Thank you very much. The view of Dr. Alaba, can you give your view on that, on what are the three main challenges? I cannot see him on the screen. I don't know if he's online. It looks that he's not connected. Dr. de Alaba? Okay, so let's move to the second question, perhaps, while he's trying to connect there. And you already pointed out there are some challenges there, and how we can manage granting access for the patients and ensuring the quality and interpretation of the results. What's your proposal to ensure that these two key issues, access and quality of evidence? I would now turn to, again, to Dr. Cristobal Elba.
Science. Science is the only way we have to deal, to cope with the challenges that we have now to implement into our national health system, the precision medicine. In this regard, my organization invests more than 25 million of euros on behalf of the Ministry of Science in order to set up an infrastructure that provides to the national health system all our capabilities, our scientific capabilities to the patients and to the doctors that now are working in the hospital and primary care setting. So in this regard, I think that one of the main steps to cope with this limitation is science, and in this regard, the Instituto de Salud Carlos III started 1 year ago this infrastructure, is the name, started this infrastructure to supply the scientific background to start the national strategy to incorporate the precision medicine into the national health system.
Thank you very much. Science infrastructure.
I partially agree with the need of more reference centers, but I don't think that we are, in a bad situation. I think we have already. I think what we need is really not to reinvent the wheel and learn from what has been done in other countries. I think different approaches has been taken in different countries in Europe, where this personalized medicine is kind of more advanced than here. And one of the things is I agree with the need of certify certain reference genomic centers, but I don't think that is going to be a major problem if we want to do so, because there is a lot of good hospitals in Spain that are doing this kind of approach. Maybe what is more needed, as I say, is again really widespread knowledge of the benefits of doing this. I think that in Genome England, all the budget for personalized medicine, of all of the budget, 1/3 of it went to training. And this is not even foreseen in our current situation. So I think we should really take into consideration this. And then another thing which is very important is that we have to, probably one of the successes of the success of the Genome England project is that it involved from the beginning the industry. So we have to be aware that without the industry we cannot move forward. And industry has to be, in my opinion, probably less ambitious and more generous in the sense of, we have to share the risk of the future of implementing personalized medicine in a wild system. And this is something that we should be thinking about. We have to work on the basis of that there is already open research is there, open innovation is there, And maybe some of the problems with the industry to be really and truthfully involved in this is the fair to open innovation. But I don't think that is really the issue. We should explain more what we are doing, and I think that industry has to be really, really a little bit more involved. Probably, we have to, bridging the gap between the knowledge and the industry in a better way. I think transfer is a profound deficit in science in Spain. Transfer technology, transfer science is something that we don't do pretty well. And I think that this kind of evolution of a common pathway between which is done in the academic laboratories and public hospitals has to be really accelerated, transfer in a much faster way than we're doing now. So I think one of the challenges that we have to make available to all population perfectly well-defined, certified laboratories. We have to train, and we have to, this can be done, and then we have to get involved more often with the industry.
Thank you. Going deeper, Dr. Borràs, with we were say accessibility and just having the same chances to get that into their patients. Adding on what the other speakers have said, what we can do more to get access to all patients with reference?
Well, yeah. Our approach here in Catalonia has been essentially precisely designate reference centers based on the previous experience that they have demonstrate with research and support to the oncology departments. And with this designated reference centers, we have set a scientific board that has proposed the panels for 4 areas, so solid tumors, hematological tumors, pediatric cancers, and hereditary cancers. And we also set a budget, a specific budget to pay for, to reimburse the panels, and to pay for the panels, and based on that also to set a quality control program to assure that the quality is comparable across the different hospitals, the 6 reference centers in the whole region. And to these centers, there is an area of population covered by these centers, so all the patients should have access to this technology, provided that the physician in charge consider that this patient candidate is suitable for a specific panel. And also we plan to evaluate and to have a shared database for all the cancer patients in Catalonia that have been take part with the samples in the precision oncology program. So I think this is the only practical way to integrate this kind of medicine or medical approach to the health systems in our region, and it has been based in a wide consensus with the leading clinicians in the field. So I think it's important to take a participatory way. We don't have patients involved in this process, and it's something that probably in the coming months we are going to deal with. But as I agree with Dr. Cruz, there is a lot of training and education that should be involved, and also public communications to the patients about the implications of this. We have had 2 sessions with the bioethics committee in Catalonia about this, how to deal with this kind of information and how to deal with the information to the patients, which is also something that is very, very relevant from a pragmatic point of view. So I think our approach is quite pragmatic, but it's based on an alliance with the clinicians, reference centers designated with a quality control, and also the same panel for all the patients in Catalonia, provided that they have the same clinical problem. So I think this is our approach, and obviously to do this, we need to reimburse the precision medicine program in each reference center.
Thank you very much. So I think we are on time with for the audience to ask some questions here. So I would invite you to ask some questions to the speakers that we have their great opportunity today with their people with their great experience with that. Can we move to the questions for the audience?
If not, I can make one.
Yeah, sure.
I knew. I mean, I'm looking Dr. Borras, and he's looking at me saying, probably guessing that I'm going to ask you something about it. About do you have any information? I mean, for how long have you been implementing this common panel in the clinical setting?
Yeah, well, we set up the program formally, approved by the Catalan Health Service in February this year.
This year.
In 3 months, we have the panels, and the program and the analysis, the systematic program with the analysis of the panels began in June this year.
I will be very happy to discuss with you within a year, just to get any idea about the percentage of covered samples that actually go through this circuit, because I think sometimes there is from experience from other communities, other regions, I think that that is the first step, which is the key step, probably the key step, and I would like to know, to learn from you about, which is actually the covered patients of that, because I think I will be happy to know that 100% of the cases are actually going through this circuit. So I think it will be interesting to me. And also, congratulations if you have been able to manage all professionals providing a common set of markers.
Yeah.
Because,
yeah.
that's a tough question.
Yeah, it has not been so complicated. So I think obviously it's difficult. For instance, in some areas of hematology, there are not such scientific base to debate the panels. In other areas, it has been very easy, like in pediatric cancers. So this is it's different. So, and also there is a discussion about how specialized by tumor site they should be, and in general we have an approach of the same panel for solid tumors, but this is something that our expectation is to review every year. So it's either for increasing the number of biomarkers, or also to change the approach. So because it's something that we assume that should be flexible, because the reality and the scientific research it's progressing and changing quite rapidly. So we are not in just a closed system. I'm happy to discuss in 1 year.
Okay.
Any questions from the audience?
Yeah, I have a question right here. Yeah. In this session and in the previous one, we have heard that the collaboration between the industry and the academia or the public bodies is really complicated. And I heard Dr. Cibudosa mentioning the example of Genomics England, that I think it's a very good example. So I would like to know, where do you think, the three of you, where do you think is the problem for this collaboration to work out smoothly? Why is it that the industry doesn't really find attractive to collaborate with public initiatives, or are the public initiatives too complicated for the industry to engage? Thank you.
If I could guess a proper answer to that question, I will be probably a golden man. I have no magic solution. I think a part of what is happening is that we are not probably convinced about that the effects are so relevant that they will benefit everybody, both the patient, the professionals, and the industry. Mm-hmm. So I think that more forums like this one are actually needed. I think, as I said before, because I know by first hand that there is a lot of excellent, good research on this field done in Spain, I think we should foster a little bit more sharing, just communicating data. So we are used to present our data on scientific meetings and clinical meetings, but we have to do something else, which is, sit down in a round table and discuss, if I put this panel on, which will be the benefit for the patient and then the professionals and then the industry. And probably if we show the industry that they will probably be benefit if they invest some resources in that research, they will be probably clearly more in favor of it. So I think it's a matter of sharing more information.
Thank you. Dr. Belda, any view on that, on their collaboration with their...
Yeah, I'm sure that there is a room for a lot of collaboration between private companies and public authorities. We have been working together for years. However, in terms of precision medicine, we have to differentiate two different concepts. By one side, the concept of biomarkers for the use of specific drugs is not included into the precision medicine. Okay? So in this regard, keep in mind this concept, by one side, biomarkers for drugs. This is the portfolio of the National Health Service. By other side is the concept of precision medicine that implies transformation in the way we perform, we make decisions with a direct effect on clinical practice and public health. In this regard, we have to have in our hands genomic molecular information at the individual level and to have the capability to integrate into clinical information with social, environmental, behavioral factors so that we can cooperate in this area with tons of data. That is very easy to cooperate in order to improve the capabilities we have to diagnose, to protect the health of our patients and the health of our population. However, many times we discuss about precision medicine, I have the feeling that we are talking about 2-3 biomarkers that we can include into a low density profile. So in this regard, first of all, we have to talk with the same concept. A biomarker for a drug is not precision medicine. It's a condition to use a drug, and that's okay. And precision medicine includes a lot of information from biological sources, but also from behavioral and social sources. So we can cooperate. It's very easy, but we have to split biomarkers and precision medicine. That, in my perspective, it's fully different. Thank you.
Thank you very much. I think we are running already out of time here, so I would like just now to really appreciate your insights today, and I would like just to go through what other tried to get your ideas and what you have shared. And for me, the main thing, it's clear that the precision medicine is a challenge for us, but also a great opportunity to really take that as a vision and a mission, but also a homework that we have for all of us. It's, of course, a journey for change, an evolution of our not only healthcare professionals, but also for our national health system. And also you have mentioned the industry, and also you mentioned the patients that are the end why we are here for. This roundtable has served to identify some aspects that I think, and I heard from you that you have a common view or things that are clear, and you mentioned some aspects like training. You mentioned that training is critical for our healthcare professionals, but also beyond that, just a good understanding and what's needed, and also training programs for the patients. You mentioned also at different levels reference centers, so that was mostly linked to their certified centers, but also having a quality of the results. Also, you mentioned the knowledge transfer. There was also mention about how important it is to share the the knowledge, but also the insights that you get, but also the results. And also there was also an invitation for learning from each other how we can do those things. Another word that was mentioned also was the budget. So there is infrastructure, and Dr. Belda mentioned that, but also linked to how we invest on that, and this is making sure that we have resources to do there. And I see that there is a common view on that. I think that all of you have identified that the patients are not yet fully there. Perhaps we should involve them more. And last but not least, and you, Dr. Belda, mentioned, I think that you distinguish something that is important that perhaps can allude also in a further work and also a further consensus, that one thing is biomarkers for a treatment, another thing is talking about precision medicine beyond how we just treat the patients because of a biomarker is needed, but just a different way of thinking and evolving the way we understand the patients, but also how we treat them. And last but not least, how we approach the data analysis, which is also an opportunity, but also a challenge. So, in conclusion, I would say that we have a lot of work to do. So that's the first thing. In all areas, at the national, at the regional, at the healthcare, at the research, and the private and the public. But also, I think that's a great opportunity for all of us. Dear speakers, it has been a pleasure to have you together today. I wish I could have you all here in those kind of shares and also having even more a broader audience. But I think it's a good start that we are getting out from the pandemic, and hopefully we can get together, because I think this deep work that we should be doing requires also sit down together in a table where we can brainstorm and also just work further to find a proper solution. I see now on the screen Dr. De Alba, so sorry that I could not just introduce because you had, I think, a problem with the connection on your side, but I really appreciate that you were also here. I hope that you can get a chance in their next roundtables to talk together, and he can also share with us the view of being an anatomical pathologist and just his experience in getting very close to the patients. So with that, thank you very much for being here, and let's keep the good work, and let's kind of don't just give up on your mission, and I hope that I think in a short time, I'm always very optimistic that we can get our patients in Spain, that they have the biomarkers being treated, but also they have personalized medicine for also predict and prevent to have diseases in the future. So thank you very much.
Thank you.
Thank you, Bob.